I had to know what my faith was. I had to really ask what my faith was in myself, in him, and in our potential for healing and wellness.
Oh, this is major. It's like the next big thing. Come catch the wave, yeah. Yeah, watch what's happening. A force of nature. Hit 'em like lightning. Be the creator of the next big thing. We're the movers and shakers. We are the dreamers, the makers. We stand on top of equators. We are the limitless. Got the future, no papers. We are the innovators. We have the focus like lasers. You know we doing it big. Oh, this is major.
Greetings and welcome to the Compromise to Alchemized podcast with your host, Dr. Neil Bolsonani. I am here excited. I'm in San Diego, actually, Ocean Beach, getting ready to go on the Hydrate podcast. But this is not about that. This is about Jennifer Tao. The conversation that you're about to listen to is one we had that I really loved because, we dive deep into the matter of healing, and that's what really guides Jennifer. I mean, she talks about this. She talks about not only her expertise in the field, and those of you who know Jennifer Tao know she's such a savvy and nuanced, healer, and also a teacher and an advocate and so much more. And I'm going to read her bio here shortly, but if you've taken one of her IBCLC lactation classes or a parenting class or any of her other classes, it's just you know that you're in good hands, and also you're learning from one of the best. So she's been in the field for quite a while, and we'll get into that. But I wanted to just say she's quite a compassionate, loving soul. And first, I loved just hearing her wisdom, but also it was really great to dive into like what guides her. So you're going to enjoy this episode, and of course, I'm excited that Lunalux has provided music, and it's all about engaging in that work that is out of this world, galactic pop. You might not think of that when you listen to it, but it's also about the feminine voice emerging and arising and shining. And that for me is a huge through line to my work, this podcast, and all the really important work out there. So that is the nitty gritty. And when it comes down, though, to the refined knowledge of who Jennifer Tao is, let's just say, she not only, I believe, has the master's degree, but she's an IBCLC, that's an internationally certified lactation consultant, massage therapist, and she also is, in the orofacial myology field, too. So she's practiced holistic lactation and guided parents in raising their children holistically for over 35 years. A fascination with the physiology of wellness has led her on a decades-long journey exploring the many influences on infant health that come to define long-term human well-being. She has a particular interest in epigenetics and in the microbiome, gut-brain health, oral functional competency, and airway development, always seeking to understand and apply the profoundly far-reaching implications of this work for breastfeeding dyads. That's mother-baby, usually, combinations. While residing between the USA and France from 2010-12, Jennifer established an international client base, becoming adept at providing care virtually, a process that ultimately honed both her listening and observational skills and resulted in a flourishing global practice. With a master's degree in holistic health coaching, Jennifer's reputation for guiding parents through complex breastfeeding challenges is deeply grounded in her approach to the breastfeeding dyad as a complex, interdependent ecosystem, resulting in her Heal the Mother, Heal the Baby philosophy of care. Jennifer's an avid learner, integrating numerous holistic modalities and an ever-expanding skill set into her practice, focusing on the nutritional, environmental, and cultural factors that influence milk production and overall wellness of the dyad, myofunctional therapy, and bodywork. And I will just attest to this, saying that she is deep empathic in these energetic ways, like really knowledgeable from a practical rounded out reality, but she's so well versed in the clinical knowledge, and so she's very exacting on that. And I just really want to encourage anybody who's listening to know that she holds those intention really well. She's a writer and lecturer, offering workshops internationally and via webinar on lactation and epigenetics, gut health and healing, tongue tie and airway development, and holistic lactation practices. She offers a year-long advanced course in integrative and holistic lactation. She is a founding member of IATP, that's the International Affiliation of Tongue Tie Professionals, and founder of the Holistic Lactation Institute. She's a mother of 3 children born at home in 1988, 92, and 98, and a granddaughter born at home in 2009. She's come to deeply embrace the wisdom and humility gained from gestating, birthing, nursing, parenting those 3 amazing human beings. Hats off. I just commend, and I say let's honor not only the knowledge and expertise that Jennifer has, but that she's a mother, grandmother, bringing babies into this world, and then caring for and nurturing them and many others out there. So can't wait for you to listen. Please like, comment, follow up, and we want to hear how this episode really impacts you.
This is major.
All right, I'm excited to be here with you, Jennifer, and chat with you. It's been really good. I don't know, fun to catch up for a few minutes as we talked a little bit about like some of the ways that we think alike. But right away, um, I think that Jennifer, you have this long-standing history in our field, and so I want to dive right in to ask you some questions about that expertise because I know things that you've said and shared have shaped what I've known and other providers out there, and so um, I love that people kind of have regarded you and looked up to you, but I really want more of that to come through in how pivotal you've been in our field. Let's just say airway, feeding, but I just think health because you're looking at things from preconception, birth, across the spectrum. So I'm excited to go all those places with you, Jennifer, and thanks for being with me.
Thank you for having me. I'm excited.
Yeah, so I know you've been doing some traveling, and so I mean, I'd love to just ask you there, like, because I want to hear it. And what did you just get back from doing? If you wouldn't mind sharing with us, and then that we can start there.
Yeah, so I was just in Milwaukee. A very forward-thinking lactation consultant, Molly Peterson, invited me to come in to support her practice, and she works with collaboratively with a dentist, Dr. Bender, who is amazing. I just loved working with him, and his practice is so supportive of families, which I liked so much. It wasn't just come have a procedure; they just really embrace the families. But there still wasn't that kind of cohesive, collaborative, sense entirely of what they wanted to have happen. So because I've been very fortunate in my local community to collaborate with some amazing people and really create that collaborative outcome, I think some other people find it helpful to have me come and kind of facilitate that for them. And that's really what we did. We saw babies who were prepared by their local IBCLCs for release, and we saw them ahead of time. We tweaked things. We educated about what needed to be done. We helped the families understand what was coming. And then all of the practitioners who were there were 5 body workers and 19 lactation consultants. We went to the dentist's office. All the releases were done there. Um, Afterwards, the body workers left, and I worked really in depth with the lactation consultants about the functional habilitation because so just to back up a little bit, since 2017, I've been co-teaching a course that I put together called Oral Habilitation of the Breastfeeding Dyad, the IBCLC Masterclass. And my co-teachers are Dr. Sharon Vallone, who is a chiropractor I have been truly blessed to collaborate with for 35 years. Brenna Hayden, who is an IBCLC, who is truly one of the most brilliant people I know. And Brenna's role was really to bring the whole concept of reflexes and reflex integration into that course. And then everyone will know Sandra Colson, who is totally one of the people I look up to in the world. So the program includes the 4 of us, and for several years, we went to cities across the United States and taught remotely. Unfortunately, in 2020, you all know what happened, so we had to put the course online. So everyone who attended had to have had taken the course. So this was a deeper dive. This is what I call fine tuning the process. And what I've been saying for a long time is that tongue tie release is a process, not a procedure. And we can get so stuck on the procedure. And parents get stuck on the procedure, which is very understandable because when you're drowning, and someone saying, "This is your life raft," you just want to get on the life raft. Completely understandable. But it does end with a lot of poor outcomes if we think about it that way. So, what I've been trying to do is bring that concept of the process anywhere and everywhere that people are willing to collaborate and work together, because I've been really lucky to have that happen in my community. So, that's what we did. And then we saw the babies afterwards for follow up, where we talked about the best way to facilitate a good outcome. And what I've seen across the country, so I think I've been involved with this since 2005 with this whole tongue tie world. I've been in IBCLC since 1996. In 2005, Betty Carrillis wrote kind of a opinion paper, I guess, with Kathy Watson Jenna about tongue tie. And she was the person who coined the term posterior tongue tie. I know a lot of people take issue with it, but it is posterior to the anterior, so I don't know why it's such a big issue. But she was the first person. She was a pediatric surgeon and the first person to ever release a posterior tongue tie. Betty was in her 70s when she became an IBCLC. I
Wow.
was very fortunate to be mentored by her. She lived in New York, so I traveled to New York. I actually went to her farm in upstate New York and hung out with her and just soaked in her amazingness and went to her practice and watched her teach. And the thing about Betty is that she was one of the most humble people I've ever met in my life. She just wanted to collaborate and learn, and I was so fortunate. Like, to this day, she's one of those pivotal people in my life, right? That made such a difference in who I am and how I practice. And so the thing that's so remarkable is that she released that tongue tie because she believed the mother. She
Mm.
didn't see, like, she didn't see an anterior tie, which is what she'd known to do since she was a doctor in the 40s. But that mother said, "I know my baby's tied," and she trusted the mother and did the release. And that is one of the reasons I have such incredible respect for her as sort of the ancestral part of this for us, right? And
Mm.
so I think
Yeah.
it goes back to her. The people who listen to parents, Shireen Liu, she just posted this on social media. The people who listen to parents,
Yes.
they take a different journey than the people who don't, right? Larry Kotler listens to parents. Like, those are the people who've made such a difference. And so in 2007, I invited Betty as the sort of person who organized conferences for Association of Connecticut Lactation Consultants, which I was on the board of. I invited Betty to come to Connecticut and teach doctors in Connecticut to do tie releases. And the only doctor who actually did them after coming was Dr. Cliff O'Callaghan, who's a pediatrician. Cliff wrote the first paper on posterior tongue tie that was ever published.
Mm.
And so the first couple hundred clients who I had who saw Cliff, I went to every release. I held their heads through every release. I
Wow.
felt every release. And every one of those babies, I referred to Dr. Vallone before the release. So it doesn't say it in the paper, but every one of those babies had
Mm.
Bodywork, by the way. So, and Dr. Vallone and I spent a lot of time feeling what was happening for the babies, like right from the start. What's happening to the with what are they experiencing in their bodies? What is the release facilitating for these babies? What is it not facilitating? What do we need to do otherwise? How much do we need beforehand? And we just worked it through over, a period of time. In 2008, I put together the first course called An Integrative Approach to Tongue Tie, the lactation consultant, the body worker, and the surgeon, because it was Dr. Carrillis who's a surgeon. So we did that. We gave that talk at Winthrop Hospital, and because from my mind, that integrative approach had to be there from the start. And so that's kind of where that began. In 2009, Allison Hazelbaker facilitated the organization of the International Affiliation of Tongue Tie Professionals. Dr. Vallone, Dr. Curlis, and I were three of the founding members. And so from the beginning, the idea that there was a triad of care, the lactation consultant, the body worker, the release provider, was always there. And for older children and adults, a myofunctional therapist replaces the IBCLC, right? Um, and there was a lot of collaboration, a lot of discussion, a lot of brainstorming over the next couple of years. And really in up to 2012, where we held our first summit in Florida, um, really there was a lot of growth and a lot of thinking and collaborating in our thinking. Like, what can we do better? How can we change this? Unfortunately, I think what happened then is a lot of people became overnight experts after that. You saw a lot of people going, "Oh, I'm an expert. I know about this." And so there became a lot of a lot of people like Dr. Kotlow, who is, I truly say, is an expert and was out there teaching. And you had other people who had just started ties and suddenly they were experts being funded by certain people to teach. And so I think in a lot of ways we went in some good directions and some harmful directions. One of the things that we did do is we went to the families and we educated the families. We spent a lot of time educating. In those days on social media in a positive way has become much more negative with all the influencers now. And Dr. Gahary did an amazing job in terms of education and creating an educational forum. But I think that in general, a lot of influencers have had too much to say. Let's put it that way about tongue tie. But that's kind of where we started. And for me personally, I always come back to the importance of that collaboration and how we learned so much through that collaboration. And in my mind, as we continue to learn, it still comes through that kind of collaboration, those kind of conversations and looking at babies together, I feel is how we still continue to grow in a positive way and change interventions in a positive way. So that's kind of where it started for me.
Yeah, I love that. I mean, clearly, you are steeped in the experience of being in the field and also working with these um, providers, especially hearing more about Betty. I love that. I mean, it's amazing that you not only had the chance to like seek out being mentored by her, but then you brought her into, and then you became this collaborative kind of force, I would say, in a good way. That still permeates today because I think that's like a like you said, um, it just makes sense that we would all be better together. But what does that look like? So I feel like you answered the question I was going to ask you next already. I mean, because in these like pioneering days of like when the field started to become this interdisciplinary village model with tongue tie, with airway,
Mhm.
um, what did it feel like? I think you gave this to me in one way, but what did it feel like to see that and to like, I guess to go inside your mind, what did it feel like for you to be swimming those waters and to see these powerful, beautiful things happen for the parents, for the babies, and for the people? How did that feel?
Well, there's a bit of a double-edged sword because for me, I looked back and realized that my own daughter was tongue-tied,
Mm,
right? And she was 13 when I realized that she had been tongue-tied and that so many things that I had dealt with in nursing her and just in her life, like sinus infections, were all a consequence of that tongue not pumping as it was meant to, right?
yeah.
Her sleep disturbances, and I have 3 children, and so my sons bookend my daughter, and neither of them are tied, and neither of them experience those. Now that's an N of 3, obviously, but
Right.
as I saw these babies, I will tell you one thing, that when I realized my daughter was tied, right? And when I realized what these ties looked like, because I was a Leche League leader and I learned that a tongue
Mhm,
tie was anterior to the tip of the tongue tie. That's what I thought,
mhm,
right? And so I knew those, I recognized those. I sent those to ENTs. And so I didn't recognize these ties that had a whole different configuration and presentation, right? And when I did, I went to Dr. Valone and I said, you have to do this with me because and so we sat down and we thought about the families that we had missed. And I called a mother who was her daughter was about a year and a half, and I said, I need to come over to your house and see your daughter. And we had become friends actually. She'd been a client, and her baby, I'd sent her to an ENT for a tie release, and her baby never nursed again. Now, her baby wasn't nursing well, but never nursing, and it broke my heart. And I went over and I looked in her daughter's mouth and I said, oh my gosh, she has a posterior tie that was never released. And I went and talked to Dr. Malone, and we sat and we thought through the last few years of kids we could identify, babies who had to continue to nurse with a nipple shield, babies who had to keep coming back for body work because they had to keep kind of getting put back enough into midline to be able to manage to nurse. And we sat and cried. We cried over it. We were like, how did we not know this? How did we miss this? But then we decided we need to do something about it, right? Okay, we can be heartbroken, but what do we do to move this forward, right? And so In the beginning, it felt really positive, like I said. I feel like people were all coming from that heart space because many of us, Dr. Malone's daughter was tongue tied. Like many of us realized we had this experience ourselves and we didn't know what it was. And we thought, well, we can prevent that for other parents. They don't have to not know what it is, right? One of the things you kind of said a little bit like, what does that look like? Right from the beginning, what it looked like for me was that these babies needed that hands on before they were ever sent for release. We did that right from the start. We felt like that was so critical, that these babies need to be in the most receptive place they could be and in a place where they could take it and run with it, if you will. They could utilize the release. Now, our understanding of that and knowledge of that has changed dramatically in the last, decades, but at least we understood that had to happen. And then we understood that whatever happens with post release, and we weren't doing enough back then at all. Like
Mhm.
understand we didn't understand, the post release facilitation orally. We didn't understand the wound care. And that's another place that's kind of gone in 100 different
Right.
directions.
Right.
And so there was a lot we didn't know, and we just truthfully tried things because what can you do except try things? I mean, that's kind of where you start. And so it felt like we were going in an important direction, but I will admit that there's a sense of wishing this. I mean, you wish it wasn't true. Like, you wish you didn't need to do this.
Yeah.
You
Yeah.
know what I mean? And my granddaughter is 16. When she was born in 2009, I knew there was no way we were not gonna get that tie released, right? I mean, her
Mhm.
parents, son and his girlfriend, her parents were not. Unfortunately, she was born at home, as were my children. She was born at home, and Dr. Vallone came every day and adjusted her because Dr. O'Callahan was on vacation. So she nursed without pain until she had her release because we had Dr. Vallone. But that was such an education for me too, to see how we can make sure a baby can be out of pain, give them the time for the release. I know this is going off in a little bit of a direction, but I'm so worried about those babies who are released in the period of high oxytocin, when
Mhm.
what be happening is just falling in love and connecting and being, and suddenly they're in this position. So I am not a fan. I mean, she was 9 days, fortunately. I'm not a fan of babies being released too early. I think it's usually detrimental, and all the ways that humans are meant to really connect in that period.
Yeah.
No, but anyway, we just kind of kept going through and learning a lot, and people came along who wanted to learn with us. And really, the lactation consultants were leading the way at that point because the people who founded all of this were lactation consultants. It has changed a lot in the last decades where I feel like it's gone in some ways in a good direction and in some ways in a harmful direction.
Yeah, I have so much more that I want to hear from you. And I think my heart compels me, both as a dad of three kids who, 9 years ago when my daughter was born, tongue tied. I mean, that's my initiation into the field was then. I didn't even know it
Mhm,
existed before then. Unbeknownst to me, the year before, I was doing intuitive movement and unwinding my own fascia for like 1 to 4 hours a day, every day almost, and releasing the posterior floor of my mouth with internal movements. And I was getting so much relief and extraordinary results in my own health from addressing issues that were compensatory to a tongue tie that I didn't even know I had.
mhm,
Um, in but when kind of those 9 years have shown me some, and then I've made sure that well, this is a great me being able to spend time with you and you learn even more, but learning from those who have been in this far longer than I have. And also, um, I guess I wanted to say something I was in chiropractic as a family practitioner for nearly 18 years. Then 9 years later, daughter born with a tongue tie. Then always gonna check in the mouth and the whole body, hands down. So I think about 3 things: the patient's parents that I didn't know, that I
yeah,
wasn't serving because I didn't know what I knew then.
exactly.
So going back, it's hard because I got the pleasure or fortune of seeing people again and saying, "I'm so sorry. I missed this when your baby was a baby, and I'm seeing it now. So here's what I'm recommending. I
Mhm,
wish I would have known." And then I see other things, and I do think that what you said was really beautiful in that, you know, there are times when like enough wasn't being done, pre, post op, and all of these things for the release. Some families don't. They just go, baby's born, like things are in dire straits, and then they go get a release without having the fortune of having great lactation support, or at least that, but then also body work to help mitigate some of the issues that could be, you know, quieted, eased, like you said, when you're dealing with that. And so I have to jump to Nick Osteo. I'm going to name it because he's definitely, I should say, like, I mean, I'm engaged with a long-standing debate with him that he blocked me, but it was a I'm very like I'm very like objective, but I started to see. I'm just naming it because I know some lactation consultants and some people who are saying that's got to be the way,
Yep.
because after 18 years of this osteopath saying he's never ever had a patient who is a baby that needed to be released, and he thinks that is not good, and he uses a lot more negative words, and he's insulting some of my colleagues, and I couldn't stand that, so I stood up to that. And yeah, he blocked me, but I have patients who come in saying, I'm wondering about whether this is necessary. And sure, they've seen his stuff. And I said, look, I'm not here to tell you you need to do this or that. First of all, I defer to people like you whenever I can, lactation, like Jennifer Tao, if I can, and other amazing IBCLCs and Myos and providers that I collaborate with that are journeying with families, but as a person who's a parent and a provider, I'm like, look, we in this case, like you need to trust your intuition, but also how is the function, how is the process. So I just think it's a time where we need even more than ever to like say sometimes I'm saying too much almost. So I'll hand it back to you in a minute here, but it's tough to see parents who were
Mhm.
went into that release too soon or didn't have the adequate amounts of help surrounding it, and then they went in and had a release, and then it was bad. The results were negative, and I think this is a really hard time in one way because there's a lot of misconstrued feelings, there's a lot of misinformation. So I think if people can have this experience where they've been under your care, they've been under the care providers who think so broadly what's really needed, how do we support families, not only physically, emotionally, and all the ways, we can see that when this intervention, when the tongue tie release is needed, it's so powerful and helpful. And I know there's many people who have said that. So, anyways, my comment to you is, boy, how do we really help these families and the providers who need more wisdom and mentoring or guiding families? How do we really help in this current state?
So so let me just say something about, Nick. He never demonstrates what he claims. There's no demonstration. You never see babies nursing. If you ever see a baby eating, it's on a bottle.
Right.
They're not feeding on a bottle properly.
Hmm.
So there is nothing in his argument that can be asserted with any proof. He just says it. We
Yeah.
don't know that it's true.
No.
So that's one thing. He also lives in a country with a very large Muslim population where nursing until the age of 2 is considered the norm. And I know I nursed my daughter who was tongue-tied for 5 years.
Yeah.
You can nurse a tied child,
Yeah.
right? I
Right.
had I had mastitis 6 times.
Yeah.
Thank goodness my family doctor was a homeopath and I didn't take an antibiotic, but I had so many negative outcomes because she was tied, and so did she. And so to be able to say a baby doesn't need a tie, my argument is, what is your assessment of that? How are you assessing a release? How are you assessing that? Now, I'm also a myofunctional therapist, and I've been doing myofunctional therapy since 2012. And I see a lot of children who were released in the way that you're talking about. They just went and got a release. They didn't have the supports, and they now have children who need a revision along with, expansion, and I'm not saying a release will prevent the need for
Right.
expansion. We
Right.
can't we
Yeah.
cannot do that, but I can
Yes.
tell you that those releases were not successful and they need a revision, and so running in and getting a release without the support, in my mind, is incredibly harmful in most cases. Sometimes it will allow you to limp along and nurse for a while. Often those babies wean prematurely and their parents don't know why, or they just think that's normal for that child. So my argument is, people will say you can't treat what's not there. You can't treat a what if. I don't disagree with that. I don't disagree with that. But my argument is you just don't have the skills to see it's there. It's there. You have to know how to assess function. You have to know how to assess feeding, and that is the role of the IBCLC. And so, and I will say this too, Neil, you know this as a chiropractor. Every profession has its wide variety of skills. People with massive skills on either end of the spectrum, and most skills in the middle of the spectrum. The problem is that we are having babies today who need everyone at the high end of the spectrum. They just do, because the babies are so complicated and the world
Yeah.
is so toxic and the world has been so poisoned that it
Yeah.
is so difficult for these children to be regulated. To start out, their voltage is low at birth. They're not making
Mhm.
ATP. Their energy is low.
Yeah.
And so we need a different skill set for all of us. And so we need to level up. So
Yeah.
when somebody like him, I would not doubt he's a phenomenal osteopath,
Yeah.
honestly.
Right.
I
I
The
get
way he
that too.
describes things, yeah, he's a phenomenal osteopath. It's funny because he's a French osteopath. I lived in France for 2 years. My son went to
Mm,
University of Kansas and saw osteopaths who were amazing.
love it. Yeah.
Yes, but that does not mean whenever someone who's an osteopath argues with him. Dr. Geis, who in my mind is one of the best osteopaths in the world, he's here in Connecticut and does guided releases with Dr. Kendall. When he argued with him, he basically just said, "You're not as good of an osteopath as me." That is what troubles me is that parents don't recognize that kind of arrogance and step back and say,
Yeah. Right.
This person's too arrogant to believe them." But
Yeah.
I have a client right now who's seeing a chiropractor who has that same attitude that babies shouldn't be released and trying to talk her out of it. And she did it anyway. But when you come from that place, how do you provide care exactly?
It's hard. Yeah.
What's your approach to care? So in my mind, the too soon is really problematic. Releasing babies too soon is problematic. And parents often don't realize they'll say everything is good, but often it's not good and they don't know it. They don't know. Often they'll lose their milk supply, their babies sleep poorly, they can't take solid foods. I have a very large part of my practice that are toddlers. Most people
Mhm.
don't work with that age.
Yeah.
In
Right.
fact, many people will tell kids that parents of children that age, wait until they're more cooperative around the age of 5. I don't know a 5-year-old who's cooperative about sitting doing exercises twice a day. I don't know that kid. So the bottom line is that you're missing all this opportunity to support the natural trajectory of growth. If
Yeah.
you So why would you wait? Let's do better for those kids. So I have a huge practice of that age of children where we release their ties. And many of those kids, let me revise that, where we revise those ties, because many of those children
Right.
were released as infants
Release.
in
Yeah.
a way that is not supportive of good growth and development and good function. And so now they can't take solid foods. They're doing that wonky tripod crawl. They're developing postural stability through tension, right? Their sleep is terrible. So there's a huge progression towards more dysfunction, and it manifests in a different way that often parents don't just know connects back to all the things that were happening when they were babies. So I say this and I don't regret saying this. A dentist who will do, or dentist or ENT, or anybody who will do a release on a baby who has not been prepared should not be doing them. That's how I feel. They should not be doing them because that preparation is so critical. And I think that it comes back to the lack of understanding of what we do as IBCLCs, this sense that all we do is position a baby. There's so much to good function. And there's so much to this is really important to understand. Breastfeeding is not about, or even bottle feeding, it's not about something in a mouth that transfers. And breastfeeding is body to body. It's human to human. It's soul to soul. It's brain to brain. It is not something in a mouth. And so if you can't address the whole dyad, you're missing so much of what needs to be supported. And we've gotten so focused on doing things in babies' mouths that it's making me crazy.
Yeah.
Like, oh, let's send them to a feeding specialist and an SLP and an OT. Like, there are too many cooks in the kitchen and there are too many people focused on doing things to a baby. as opposed to bringing that baby back into the space. What is the space in which an infant is designed to feed the body of the mother? So we need to bring the baby back into that space and make that space safe and make that space supportive. And the person, that other person, that parent, they need to have competency. They need to feel they are competent. They need to be confident. They're the person we need to work with. It's not just doing things to the baby. And I'm seeing far too much of that, of moving in that direction. And that is really harmful, in my opinion.
Yeah. Jumping back, like I think since 1990, you formed this intuitive parenting network. Is that right? Is that the right timeline?
Yeah, well, so my background is actually my undergraduate degree is I have a fine art degree actually.
Yeah.
Um,
Okay.
so right, so I when I graduated, I worked as a photographer, art director. My ex-husband and I owned a design studio, and that's what we did, and I loved it. However, we had our son, our first son. Um, well, that's what happened is that when I was 26, I was diagnosed with endometriosis.
Mm.
And for 3 years before that, I was in massive pain every single month, and no one could tell me why. And so my sister, who's a nurse, said, "I think you should go see my OB, GYN, her GYN." And I went and saw him, and he did a diagnostic laparoscopy. I said, "No treatment, just diagnosis." And so something happened, and I know that you really connect to the spiritual aspect of things, so I'm gonna tell you this. So I was in the recovery room because it was general anesthesia, and there was a baby crying. Now, I had said from the time I was 16, I never wanted children. So this is 10 years of I got married with plans to have no children.
Hmm.
In the recovery room, and there's a baby crying, and it was driving me nuts. I kept saying to the nurse, "Is that baby okay? Someone needs to take care of that baby." I was so upset that the baby I felt wasn't being taken care of. I mean, I'm sure the baby was being taken care of, but in my you know, drug stupor. I thought that it wasn't, but I kept asking about it. I feel like that baby was reaching out to me. And so the day I had that procedure, I was home from work and I read an article about homeopathy, which I'd never heard of. And I called. There was a phone number for the National Center for Homeopathy. And I called and I said, "Is there anyone in Connecticut who does this?" And they gave me 4 names. I'm sure there would be 100 today. And I called. The second person answered the phone and he said, he's a medical doctor, and he said, "Well, that's not how homeopathy works. We don't, it doesn't matter what you have. It matters that we treat the person." And I was like, okay, I'm doing this.
Yeah.
I will tell you that for 35 years, he was my doctor, and he answered the phone twice in 35 years. And that time that he answered is the reason I went to see him because his voice was so, just so supportive. So
Mm.
if he hadn't answered the phone, if that baby hadn't cried, there was just this series of things, the universe bumping me, bumping me, bumping me. I went to see him. I was on Darvocet every month. I was in so much pain.
Oh wow.
I went to see him. I never took another drug. I haven't taken an over-the-counter medication. There's been one in my house in all those years. He gave me a homeopathic remedy, and within 6 months, I was completely pain and symptom free. But the other thing, if you know anything about homeopathy, is it does not treat. It treats the space between the notes. It treats the soul. It treats the
Mhm.
part you can't find. And it just drove me into challenging about why I didn't want to have children, and that my body had responded to my statement that I didn't want children and created an environment in which I would not be able to have children. And my endometriosis was severe. It was very severe. And so I conceived my first child in 2 months. All of
Wow.
my children were conceived very quickly and easily after that. But so that was the beginning of my sort of understanding the bigger picture of who we are as human beings and how our interface with the physical world and the spiritual, mental, emotional world is really needs to be attended to by anyone who is supposedly a healer or a healthcare person, right? And I'm troubled that we've lost the concept of healer. Now it's like healthcare,
Mhm.
right?
Yeah.
Healer should be. And so so I had my son at home and I became a little League leader. And then I had my daughter. And after my daughter was born, I said to my husband, I'm another logo is not going to make the world a better place for these kids. So I wrote a grant and started the breastfeeding peer counseling program at Hartford Hospital. I trained 40 peer counselors over 3 years. We saw 2,000 women during that time. 25% of our clients were teen mothers. It just changed my understanding of why people breastfeed, what they need to be, how they need to be supported to breastfeed. Because what was happening is I was volunteering at a WIC office and we were having 30 mothers come for lunch. It's like a lot of mothers were coming wanting to breastfeed, but by 6 weeks they were all bottle feeding. And I just thought, I'm a part of the problem here. I'm engaging people in an interest to do something and giving them no support to do it. I'm not helping. And that's why I wrote that grant and decided I was going to go and help them be able to breastfeed. And I just learned so much about that and how if breastfeeding is a part of your identity, you're going to do it. If it's not, it's sort of an option then. And so, how we as a culture approach breastfeeding, I always say breastfeeding is biologically easy and culturally very difficult in this country, in the West. We've made it so difficult culturally. And so we present it as breastfeeding is hard, but biology isn't that reckless. Biology isn't reckless. We would not make something hard that is necessary for the survival of a species, but our culture sure would. So that's kind of where we are and I really came to understand that. I went into private practice. I became an IBCLC in 1996. I left that hospital. I had my youngest son and I went into private practice. So there was a huge kind of process for me in terms of an awakening and I just had a second awakening when my oldest son was 5.5 years old. He does not have a portal vein, but we didn't know that. And so he had a stomach bug and he started to bleed out. He vomited and he was bleeding out. And so he was in PICU. He had to have, highly invasive treatment. And the gastroenterologist wanted him to wear a medical alert bracelet and wanted him to be scoped every 3 to 6 months and put him on beta blockers. And remember, this is 1994. So I went to the library because there was no internet. I went to the library, medical library. I copied every single paper on beta blockers and extrahepatic portal hypertension, a stack, and I read them, and not one of them supported the use of beta blockers, not one. And I said no. And I said, we're not putting a medical alert bracelet on him because I'm not going to have him walk through his life with something on his arm that tells him he's a sick person. That's just going to be what we're going to create. I'm not doing that. And I'm also not going to have you scoping him because that is traumatic. So I will find another way. And so someone mentioned a PT to me, Steve Moran, who I credit with saving my son's life. I took him to him and he started working and he said, look, he has a system that has a deficit. We support all the other systems in his body. And that's what they did. I started him with acupuncture once a week. We were already seeing our homeopath. He started on Chinese herbs with our naturopath. We did energy medicine. They said he couldn't do sports because his spleen would rupture. He had a black belt in martial arts at 14. He did he did parkour, he did gymnastics. He's now an acupuncturist.
Wow.
So I had this place where I had to know what my faith was. I had to really ask what my faith was in myself, in him, and in our potential for healing and wellness. And it's why I am challenged with this tongue tie situation in a lot of ways, because so much of our intervention precludes all of that. It's just do a procedure.
Hmm.
And if all we had done is a procedure with my son, none of the other stuff would have happened, right? None of the rest of that story. And so it's very hard for me to think about it where I see these kids just being promoted into or pushed into, let's just do a procedure because it's not embracing the wholeness of who we are and how we got here and what we're trying to facilitate, right?
So much. Well, yeah, I'm just riveted by each of those awakenings because they just show how. I mean, I don't know. I just think of so many thoughts. Like you were so driven. So, I mean, you like you said, you made that phone call, and if that homeopath didn't pick up the phone, it
Yeah.
just these things. But also this propulsion, like behind you of just like guiding you, driving you
Mm.
to go to these places. That's extraordinary and it's really powerful. And so I think it would be hard, even harder with that kind of like emphasis and perspective on life because you're really talking about what is life, like what is overcoming obstacles and what will I do, like you, Jennifer, in order to not only help those in front of me, but then you had this need with your son. And so I think, well, that is like powerful. So I I want to jump into so many specifics there, but I'm really more like drawn to like where did that come from? this behind you force that's in you, like what do you feel like this drive, because I know you advocate for care for those that you see, and it's like it means a lot because you're not just saying theoretically you think people should have these modalities, these concepts in mind when you're trying to look at the multifaceted form of health that we have. Like as a healer, you are a healer. So do you have healing in your lineage? And or like where do you feel like, and I guess I want to ask you too. I'm gonna ask you about your personal legend. I'm gonna ask you what is your purpose on this planet. I can feel it already. Anybody who's studied under you has felt it, but I'd love to hear it in your words. Kind of, you could collide that all into telling me behind you, and within what's guiding you.
So I don't want to go too far into things where people will not listen to you. This is what I have to say. I mean, this is a bit of a, my I have a lot of things in my story. I studied past life work with Brian Weiss. I studied, I did studied chronic healing for 10 years. I took training in the reconnective healing, and did reconnections for many years with Eric Pearl, who I think is a brilliant person. Um, I studied with Laura Day, and I did psychic readings for years with people.
Mm,
So what I think though is something that I refer to as recognition. I think it's just being human. I don't think there's anything special about it. I think for most of us, it just gets blunted.
yeah,
I think just being human. And I
yeah.
think that for me, I just wasn't willing to walk that path that I was being pushed down just by an allopathic model. There was a moment where I just said, This doesn't feel right to me. This isn't where I'm meant to go." In fact, when I did get pregnant, I went back to that same gynecologist because I didn't at least he got this right? At least he figured out the endometriosis, right? So I didn't know anyone else because everyone else hadn't figured it out. So I went to him and he said, I said, "I'm pregnant." And he said, well, he goes, Did you see someone else? Did you go to someone else for the surgery?" And I said, "No, I didn't do any surgery." "Oh, well, you did the drugs?" I said, "I didn't do any drugs. I did homeopathy." He looked at me, he said, "That doesn't work." Now
Mm,
I'm sitting in front of you, no longer in pain after 3 years,
mhm,
and you have the ability to literally tell yourself a story, a lie about the world around you because you cannot know what is true. You cannot go past the walls you've built around yourself. So I walked out of there and I turned to my husband. I didn't know home birth was a thing, by the way. I just said to my husband, I can't go to a hospital and have a baby. And so I talked to my homeopath and he gave me the name of a midwife. I think that when you know something doesn't align with you, something else opens up. But
mhm.
first you have to be willing to know it's not that. Right? What's his name say? Hmm, I'm forgetting his name. The guy who awakened the giant within. I'm sure you know who I mean.
Yeah, it's right on the tip of my
Yeah.
head.
So what he said, right? So what does he say? He says to make a decision is to rule out all other possibilities, right?
Mhm,
So for me, it was ruling out those other possibilities. I wasn't willing to do those things. I see mothers all the time who have that in them, but our culture denies them. Mothers who I see today are constantly being told by social media, by influencers, and by a disease management model that they are wrong. Their intuition isn't trusted. Their their ability to know their own babies isn't trusted. And so when I see mothers come to me and they're just saying, "Well, I'm anxious," I say anxiety is a natural response to a completely inappropriate situation. You are having a normal response because no one is listening to you, and every mother knows what wellness looks like in her child, and you know it's not there. You have every right to be anxious because no one has stood alongside you and said, "I hear you. You're right. Let's solve this together." Everyone has said to you, "You're wrong. You're just anxious." And that's what's happening to mothers. I did not have that happen to me, in part because social media didn't exist, right? So
mhm,
I think that mothers today, parents in general, but mothers in particular, face a really strong pushback against their innate intuitive skills, right? Or knowledge base. And I just, for whatever reason, look, I wasn't raised in an attachment kind of way at all. Right. My mother sadly lost her mother when she was 14 and really didn't know how to be a mother. She was very detached. She was a good person, but she was a very detached mother.
Mhm.
I did not know how to not I didn't know what it looked like, so I just read everything. I read, the continuum concept and our babies ourselves, and I read all of Dr. Sears books, and I went to the Leche League, and I just parented that way. And when people said to me, "How did you know to do that?" I said, "Recognition. It's in us. It's in our genes. It's in our ancestry. It is there. You just need to let it turn back on." And I just let it turn on because it was already there. It didn't come from the books. It's like you were reminded by the books, right? And I feel like today, parents are struggling in a way they've never, ever, ever had to struggle before because all of that inner wisdom, inner truth, that story, they're being told they're wrong when they feel it and they know it. Right. And everyone is told that they're supposed to detach from their babies, and everyone is told that their babies are supposed to sleep through the night. Don't even get me started on sleep trainers who should be abolished as anything. And so there's just so little of our normal physiology being honored today in parenting, right? And so I think I didn't have that. I didn't have that struggle.
Mhm. Mhm.
So I do think though that some of the other things I mentioned are a sort of a source for me in other realms and times and places, but
Mhm.
but I don't know, it just lined up for me. It just all felt like it made sense,
Yeah.
you know?
Mhm.
And
Well, I
so
think go ahead.
yes. No, I was just gonna say that so I feel like I'm able to facilitate that for other families.
Mhm.
I think that the more you walk a talk, the more you can share that talk in an honest and legitimate and authentic way with other people,
Yeah.
and the more they can hear it as opposed to I mean, nutrition's a great example, right? I see people all the time talking about nutrition who don't themselves embrace good nutrition. I don't know how I people have to know that's not real then, right? It's just fact, it's just information, but it's not embedded in something deeper than that.
Yeah. Yeah. 100%. Yeah. Well, I feel like I was totally just, in a good way being absorbed into your articulating so many wow, like kind of moments in that depth, the depth of healing, compassion, and I share so much. I'm resonant with so much of what you said, and even though I only got into understanding tongue tie 9 years ago, I journeyed with a lot of families. Love supporting moms, fertility issues, prenatal, postpartum, through the pregnancy journey, and then now getting more of a sense in the last 9 years of what's really been going on with some of the postpartum struggle with breastfeeding. But one of the things that I've said so many times to these families and the dads and all the families who come in or whoever is part of that family system, even beyond the nucleus. And I remember this one family, they had a doula, Chinese, their Chinese heritage, they brought their doula in. The doula was doing a lot of the caring for the baby. Anyways, in these situations, I just see so many times where the intuition of that family was smashed.
Exactly.
I my wife, she dealt with something where, when we had our babies at home and with our first, we had the tongue tie release after a few weeks into her life, and it was night and day with the team we had, including me, and in terms of I was so thankful for that release and the night and day effect that it had, and it was profound. I mean, clear as day, right? So we typically are very holistic, and we really only were seeking out a pediatrician in our town in this instance because we wanted, just in case, in any ways. So we went into one of the offices, and he said, when she found out we had a tongue tie release, he said, well, it's just a coincidence that that helped your breastfeeding. He said that to my wife, and he said that to us. And I talk whenever I teach and I train other healers in, what I do, or whenever I have the pleasure of getting to speak to people, I say I don't name him by name, but I say that's the poo-pooing pediatrician. And not at all am I speaking against the pediatrician field. I'm just saying so many moms have been invalidated by people in the medical world saying, don't worry, it's not a problem. It's you, it's not your baby, or you just need to tough it out, or that's normal, or just wait till later, or that's not a tongue tie. It's just so much misinformation, and not misinformation like harmless. I mean harmful misinformation to the point of gaslighting, invalidating emotionally. And then I had, conversation with this pediatrician, and he just didn't listen, and I tried reaching out. So then 7 years later, 2 years ago, I had a family that came in, and this mom and this dad and this baby was now, I think it was 11 months old, and had seen this pediatrician, was told, no, no such thing as a tongue tie, doesn't matter. The baby struggled. They had to get a copter to a nearby hospital, and ended up with an amazing release provider who sent the baby to the family to me so I could do body work for this baby before the release. And I'm like, man, it is so harmful when people who don't know say things outside of their understanding.
Yep.
And I just feel like the intuition part is so, I just love when I'm with families and I say, you know what? You've got to trust that intuition, because I'm giving you opinions, and but I want you to know, yes, make an informed choice, but deep down, like, especially as a mother, you are a healer, and that feminine voice, the feminine intuition, our field needs it more than ever. So I've been telling people left and right, as a man, not as a woman, because you have a place to speak to this that I can't. I'm like, we are so in a field where we talk about forcing, widening, expanding. We need like the suppleness of the feminine. We need and I'm not saying body work is all feminine, but I'm just saying, um, that intuition needs to come up as like such a high point on the evaluative and diagnostic process, and also how we navigate these cases. So it is so important that your voice keeps getting out there, Jennifer. So I just feel like that's really needed within our field and times, when people are told, don't do this, do that. And I'm like, yeah, like you said, I'll just say one more thing. Going back to that guy in Kuala Lumpur who's speaking, and I'm like, if we can't pick up the narcissism in his voice, if we can't pick up the gaslighting and invalidation, I feel for those families that are trusting that when they
Exactly.
can't sense that. But I think that's not their fault. I think it's because they're so used to being told, you don't you they're so used to being told something, that they're waiting to hear someone else that'll give them that answer, and it looks like something good, but I know it's harmful. So I'm really eager for the care and compassion that you have to just, you've mentored and taught so many, and I'm so thankful for that. And this is a wave that needs to kind of boom and beam out even more and even stronger during this time when people are given a lot of misinformation.
I want to say something, if I can, about that. What's so unacceptable is for someone not to level up their skills, right? Because you
Yeah,
cannot be in this anywhere in this field and not see it all around you. So to
yeah,
keep denying it, keep denying it, keep denying it. The problem is that we, as at least in the United States and certainly the West, mostly in the West too, this idea that we've made medicine a religion, and people are actually bullied into not questioning. The concept of informed decision making is really just lip service. It's not real because the information isn't given by which to make decisions. And my feeling is that our job should always be to leave a family more confident, not less confident. It's not our job to destroy a person's confidence, right? But how do we handle the denial of what's going on? We normalize dysfunction. So we normalize that a baby can't breastfeed, right? We normalize that a baby just doesn't want to. We hear people saying things like some babies just can't breastfeed. Well, what you're really saying is some babies were born to die, because there's nothing in our wiring that expects a bottle if we can't nurse. Remember, as Michelle Chatham said, breastfeeding is a vital sign. If you can't breastfeed, you were not designed to survive. I'm not saying a person should have to choose to breastfeed. That's not my point. But every baby should be capable of doing it,
right.
right? So when a baby isn't capable of doing it, that baby is at risk in so many ways, right? Because that is the first assessment of survival. We take a breath, we take the breast. That's the process. And so when babies aren't able to do this, what do? We normalize the dysfunction. And we do it in so many ways. We act as if it's normal that babies have eczema, that babies have asthma, that babies have reflux, that babies have colic, that babies don't poop multiple times a day as they should, that babies don't crawl, that babies are now all delayed motorically. Now it's just normal. It's not normal. It's a reflection on the harm that we've done in our culture.
Yeah.
We have such poor statistics in our infant mortality, morbidity, maternal mortality, morbidity, and yet we keep arguing that the same things that have caused those terrible outcomes, we should do more of it. That's the argument, and we should cling to it as if it's in some way serving us, and it's not serving, and it's not serving families. But fear is a powerful motivator, and that entire disease management system is based in fear and grounded in fear. Right? And so that's the tool that's used, I consider a weapon, that's used all the time for parents to sort of get in line and do what they're told. And also, what parent isn't going to want to be told they don't have to do something? Who wants to do anything to their baby?
Yeah,
Like,
exactly.
right? And the other end of it is I mean, I am probably raised my kids in a more holistic way than most people you'll ever come across. And yet
Mhm.
people presume when I'm advocating for a tongue tie release, they're like, oh, well, we don't believe in interventions. Well, neither do I when
Right.
they're necessary. I
Yeah.
don't either, believe me. However, we've changed the course of we've epigenetically changed who our babies are. In a very short time, you know this, the environmental pressures
Yeah.
have been so powerful that we've made changes. Now, what worries me about that is that as soon as we think we have some concept of maybe an understanding, people cling to that as the answer, right?
Right. Right.
So in 2012 at the IATP summit, I invited seeking Ben Lynch to do a talk on tongue tie because in 2000 and what was that 2012? So in 2010, back when 23andMe was still doing tests for babies, you could still do babies. I was sending my clients for 23andMe testing for their babies. I have to apologize to the universe for that, but for their babies. And
Mhm.
what we found was that 85% of the babies who had MTHFR mutations had tongue ties, a much smaller percent who didn't have those mutations had tongue ties. So I contacted Ben, who, as you probably know, was the expert on MTHFR at the time. And I said, hey, this is what I'm seeing. And he said, let me do more research. And my clients actually paid him to put together a webinar, the first
Mhm.
webinar I ever done on it.
Well,
And they funded it for him to do it. And then I invited him to come to ITP in 2012. And when I gave my talk, what I talked about was neural crest migration and how failure to methylate impedes
mhm.
neural crest migration, which, as you know, is responsible for the development of the midline, the nervous system,
Mhm.
right? And I said, there's something here. We don't know what the answer is, but there's something there. And then all these Facebook groups started with, oh, MTHFR causes tongue tie. I'm like,
Yeah.
it's not what we said.
Right.
And so, right. And then people misunderstand that. I mean, certainly I tell people never to take a prenatal vitamin that contains folic acid. But I mean, if you're eating a standard American diet, it really doesn't matter what's in your prenatal vitamin because you're ingesting huge amounts of folic acid. Like there's just such a disconnect in understanding in a more global way, right? Like, and so much about intervention is about like doing things, right, to people. But the baseline for me is go outside and get the morning sun with your baby and set your circadian cycling with your baby in the morning. Like, why do you think that your baby isn't sleeping at night? Well, for one thing, babies don't sleep at night, but as that progression begins, it begins because you don't have blue light on at night and because you've gotten morning sun on your eyes in the morning. Like, do that first. Mineralize your body so that you're not stressed, because this whole sleep thing that we have going on, where the reason that everybody stresses because they're not sleeping, we are biologically designed to nurse our babies through the night. We are meant to do that without harm to us, because biologically harming the mother is harming the infant. Nature doesn't set up a design that harms the mother. It makes no sense. So if our design is to nurse our babies in the night, why are we struggling so much with it? Now, people will argue it's because we have to go to work the next day. Mothers have always worked. When did they not run the farm, run the local business? When have mothers not worked? Okay. The other issue is, in my opinion, the reason that it's such a challenge is, number one, we separate mothers and babies in the night. That's a nightmare. But the other reason is because everyone's so malnourished.
Mm.
They're not getting quality sleep because they're so malnourished. their nervous systems are not getting the benefit of that, and because so many of us have airway issues,
Yeah.
the quality of sleep is so compromised there. So instead of looking at that dyad and saying, how can we support all of this in the dyad? How can we support nourishment? How can we support sunlight? How do we support grounding? How do we instead we just say, well, put your baby in another room so you can sleep. Well, your sleep wasn't good before you had a baby. It's not going to be good now. It's not about quality, right? I mean, it's not about quantity. Your quality of sleep is really poor. Like that's the thing. We don't. And so what we do is we set the baby up to take the brunt of the consequence for what is happening to everyone, everyone in our culture, instead of saying, let's put the brakes on this harm we're doing and let's find a way to heal that family. We just ask the baby to take the consequences. Right?
Yeah.
That's what troubles me so much about it. We don't look at the physiologic norm and say, "This is our design. If this was our design, why would this be happening? Why would we need to do this? If this is our design, we should be able to manage it. Why can't we?" Does that make some sense?
Yeah.
So
100%.
yeah. So that's and so I mean, coming back around to the whole tongue tie thing, which is kind of where we started, right, this is not our design. This is not our design. And I will say this, and it troubles me to say it. I do believe that the epigenetic pressure is towards mothers not being able to birth. That Michelle Odent warned about that 20 years ago. That the more we have cesarean births, the more we have medicalized births, we will lose the genetic information that tells us how to give birth. We are doing the same thing to breastfeeding. The pressure is now pushing us towards babies being capable of bottle feeding instead of breastfeeding. And if we don't rescue breastfeeding, we don't rescue that. We can't change the course of that.
Yeah. That's a clarion call, and I think it's you said so many things, especially with I think I see so many parents who they just like, why is this happening? You covered it in one way. Because people want to jump to it's a this latest thing or this latest research or like you were part of opening up a world of connection. And I think we're so led in this world to say, okay, well, if that's the culprit, I want to deal with that culprit. But
Understandable. Mhm.
taking a wide berth of stance of like healthy lights, healthy emotional connection, healthy even like perception, like you said, the perception of um, what kind of somebody that might jump to like, well, ever since you know, well, I think you brought up that example of a family has a baby, sleep was already an issue, but then now you're lamenting because of the interruptions during the night. And I'm not saying this to any mom who's struggled with this at all, but what I'm saying is that it is. I think we're in that time culture where we want to treat something instantly and remove the negativity from something instead of journeying through it. But you're not at all. I think I had the same. I was holistic, natural, in my practice, but then nothing like seeing like, oh, but this tongue tie is not going away by any natural means.
Right.
And so that completely changed my perspective in some ways on how I even looked at other surgical outcomes and things like that too. I just said, well, you know what? No matter what, I just need to support my daughter, my kids, my family, families that I see with what is the best possible intervention for what they need at this time, but with the proper cohesive support. And I, you know, kind of say that that's missing a lot because I think you said this too. We can like I think a lot of families are jumping to like, well, if I don't take this vitamin and I do this detox or cleanse, will that prevent tongue tie? I'm like, who knows? Like it is so hard to travel down that path, and I commend anybody who does, and I definitely have been involved in some of looking into that. And but, um, but I think what's often, like, left out is, like, the nervous system and the emotional state, and is there support for this family, which is again why I love you do as IBCLC and the other things that you do as well with the Myo. But I think families, so I feel like I'm all over the place with my kind of response to what you said because it brought up so many good things. But leveling up is so needed right now. It is so needed. Every practitioner who isn't leveling up, we're leaving something behind in how
Can
we
I
help families.
can I
So
say, yeah,
yes,
I just wanted to say something about that just for you as a chiropractor,
yeah,
which
please
is
do.
right, because I have a global practice. So you know this because we're sharing a client right now. I have clients all over the world, right? And one of the things I see is that a lot of body workers are not leveling up, including chiropractors. And when they, because they can build their practice without doing it, because everybody's referring now. So fortunately, those referrals are happening, and people do know that we need the body workers. So their practices are full and busy, and they don't really need to gain those extra skills. So I appreciate a voice like yours and like Dr. Vallone in this field who are saying, "Hey, we need to do this too. Like we need to be a part of that story because those who do, I mean, the different it's night and day in what they provide." Then the one other thing I wanted to say, because we started with this, is that wide angle lens. Because what I see, and I tell my clients or my students this all the time, you have to take the whole history. It doesn't matter that you see the tongue tie across the room. You need to take the whole history because that is happening within the context of humans and a dyad and a family. And we have to understand how we support that whole family because so many of these kids have reflux. So many of these kids have dysbiosis. There's so many kids who are dealing with the genetic pressures of a mother whose own microbiome is out of balance, or the epigenetic pressures, I just say, of a mother whose own microbiome is out of balance, which is why I say heal the mother, heal the baby.
Mhm.
We have so many people now who are unwell having children and they don't realize how unwell they are because it's become the norm to have thyroid dysfunction, to have insulin resistance, to have all kinds of inflammatory issues going on that they don't realize that that is having an effect on their babies, right? And so the other thing we're seeing so much of are mothers who struggle with their milk supply because of insulin resistance, because of thyroid dysfunction. And because those lab values are so wide a range, most are being told they're fine when they are far from fine. So that's a whole other place where there's like a whole other place where people can fall. If you could think about a cartoon where somebody falls and they land on a ledge and oops they fall from there and then they hold a tree limb and then they fall from there. It's like people are falling so many levels down because there's the next thing and the next thing and the next thing, and if we don't address the sort of bigger picture, we're not going to be able to catch those families, right? And so that's why I've expanded what I had to do. I had to expand what I had to do to help people because nobody else was doing it 20 something years ago, 25 years ago, helping with gut health and healing because no one was helping these families. And that is a big piece of what needs to be addressed too. So, like in myofunctional therapy, I won't work with anyone who doesn't address inflammation. Babies are different, but for a child or an adult, because you're not going to get good results. An inflamed person doesn't heal well. And inflamed people don't get the benefit. They could still be having, tonsil issues or skin issues or so much inflammation that lymphatics don't drain or whatever. That we have to address the bigger picture. And people, hopefully, if we did that as an interdisciplinary kind of group, if we understood that all of us together, then families would get the same message from all of us, right? But that doesn't happen because so many people will go in. I turn away most people who come to me for myofunctional therapy, to be honest, because anybody can do exercises, right? If that's all you want, there are a lot of myofunctional therapists who do only that. And I don't think that's a great service if that's all you're doing and not recognizing where people need other services, like other,
Mhm.
right? And so I guess all I'm saying is that I would really encourage parents in particular
Mhm.
to kind of assess the depth of knowledge and skill of the people they're working with, and us as well when we collaborate and communicate and refer, to kind of expect as we level up for them to be doing that along with us. And I think you, I, other people who are doing this need to keep on beating that drum that our families deserve for us to do that.
Yeah. And I think that's perfect because I was wondering what your wisdom would be for leveling up for the parent and the families. And I have families who I do virtual work with, like people from all over. And
Mhm.
by the time people find me, they're down the rabbit hole and they're already like, some of them not. They don't know anything, right? They're just coming to me because, like, we just heard you on this podcast, and where do we start?
Right.
Other people have been to so many people that by the time they get to me, I'm like, you're doing so much. They don't need leveling up, so to speak. But how would you encourage people who, um, the parent, the family, how can they best level up when it comes to understanding and navigating this?
So one of the things that I would say is stop listening to influencers, because so many people out there who are posting their expertise have literally never worked with anybody. They don't actually have the responsibility of working with a family, working with a client, working with a baby, and
Mhm.
their outcome is very different from somebody who can just say stuff on social media.
Yeah.
There's no responsibility in that, right? So the outcome doesn't really fall on you. You and I, our hearts carry that.
Mhm.
Did we think about that family? Are we serving them? Are we caring for them? Do we need something more? Do we need other information? They don't People, influencers don't have that. They don't carry that. So that would be the first thing I would say, is to stop getting your information there.
Mhm.
Um, and honestly, read books. Like, people have stopped reading books, but there are so many good books. Like, read Helen Ball's book about sleep. You will not want to sleep train your child if you read Helen Ball's book about sleep. Like, read books like, Our Babies Ourselves by Meredith Small. Read books again. Listen to them on tape. That's what I did when not for at the beginning, but that's what I do now all the time. Podcasts are different often because podcasts go deeper, like we are, versus just listening to something on social media. But also ask for the education of the people that you work with. How long have they been doing something? Do they collaborate, right? I'm going to say this, and I know it's not a popular thing to say, but in my field, lactation alone, right? When I became an IBCLC, you had to have worked with families for 2,500 supervised hours before you could sit your exam. Now, that's a lot of time, and I don't think that's fair. It's way more than most professions. So they reduced it, but now it's reduced to between 300 and 1,000. Nobody can become competent in 300 hours. It really should be somewhere between 500, 800, something like that. I mean, as a massage therapist, I feel like I had to do more training than what people do today as a lactation consultant, right? And so what a lot of people do, like you could do this, Neil, because you work with babies all day, every day, you could decide, I'm going to be a lactation consultant too. So all the work you've already done with babies, you would never need me or some other lactation consultant to make sure you're actually skilled in lactation, because you already work with babies, and you could go take that test with just a 90-hour course. That is what most IBCLCs are doing today. If they already have another profession, they're tacking on the credential and
Mhm.
saying IBCLC. And technically they are, because the whole system is gamed in that direction. That is not serving parents. That is not serving parents. So people need to know how a person is trained and what their skills are. Just because you're the baby chiropractor in your community doesn't mean you actually leveled up your skills in working with babies. I know that's hard for parents to sort that out,
Right.
but you just have to know we're not all created equal in any of these fields, and it's worth paying the money. I tell my families, if you're going to see a chiropractor who spends 10 minutes with your baby and you're going to spend a $30 copay and you're going to see them 3 times a week, you're going to spend more money than seeing a skilled chiropractor who's spending an hour with your baby and you only have to see them twice. It's a very big difference. So it really does matter, the skills. I used to teach a course called Heal the Mother, Heal the Baby for parents, and I stopped doing it because I felt like the information became outdated, but I am going to put it back together again.
That's exciting.
I feel like I need to do it. I also taught a series called Raising Children Holistically,
Mhm.
right? Home remedies, cell salts and Bach flowers.
Mhm.
So I think I'm going to I really have it on my list to redo at least the home remedies part. I'm also putting together a webinar with a couple of dentists and Sharon and an osteopath, because I want people to understand buckle ties.
Yeah.
They understand buckle ties. So those of us who really have this sense that parents have the right to be educated too, right? We can do that. We can do more to educate parents. And I think we need to do that because there used to be conferences for parents. Like Lactation used to have annual conferences. There used to be places to go meet with other people and get really good quality information. Very difficult to do that now for parents.
Yeah. Well, I'm really excited that you're going to put back online. And I mean, would be so excited to send more people. I'm sure there's so many people out there who would be thrilled to get your wisdom, because there's going to be people that grab it from wherever they grab it, right? And so you put out things that are so steeped in care, wisdom, and experience. So I'm going to send all my families to you to get that education. Um, I do, and I want to know also. I know so people will have your website and all the places, all your information about what you have. Everybody will have that in the show notes. Um, so I want people to make sure if you haven't somehow come across Jennifer, then you're going to know where to learn so much across the spectrum, not only the parent, but the practitioner. I know your IBCLC master classes. I've so many IBCLCs have taken that, or um, and right now is that you have other online courses also? Is that right?
Yeah, so all of the reason that I designed the courses the way I did, they're only for IBCLCs with the exception of the one for plug ducts and mastitis because I wanted
Yeah.
that one to be for anybody who works with parents.
Right.
Um, but not anybody, but like you could take it. But I wanted it to be for IBCLCs because what happened in our field is that to become an IBCLC, you had to have 90 hours as like a didactic education. So a lot of programs were put together to teach that, which is great. But over the years, they started to say, well, this is enough. We're going to become its own certification. You're going to do our 90-hour course and you're going to become a certified something. And we tack on certifications in this country like every weekend course is a new certification, right? And parents are very much misled by that.
Mhm.
And so all of these courses became certifications and told people that you can just go practice clinically. You've never ever seen anyone clinically. You have no clinical training, but you can go and do that. So I decided I was not going to provide this level of education to people who did that. I was going to provide this level of education to people who had become IBCLCs. We do have a pathway for chiropractors and osteopaths. So the master class, there is that pathway for chiropractors and
Yeah,
osteopaths
that's right.
where Dr. Vallone adds in extra work, extra that's not there for the IBCLCs, obviously. Um, but I decided that I wanted our profession to level up and do a better job. And so then I did a course on gut brain for IBCLCs, which is 11 hours on understanding the sort of the underpinnings, the epigenetics, the thyroid, the insulin resistance, and understanding how it's affecting breastfeeding. The breasts need to be insulin sensitive to build the architecture to make milk. It is so critical that we understand the importance of metabolic function. We need to be metabolically flexible. That is our design, right? So to understand that metabolic flexibility and how that impacts feeding. So I put that together. Then I have a bunch since I've worked remotely since 2010, about
Mhm.
85% of my clients are remote. I did a course on, working with babies virtually. I did a course on older babies because so many IBCLCs are afraid to work with older babies, and yet so rewarding to work with older babies. So I have a course on working with older babies. Um, so initially, when we were teaching, when Dr. Carrillis had a stroke and was no longer able to teach, I invited Dr. Kotlow to teach with me and Dr. Malone. So the three of us were teaching together, and we were teaching to everybody, to the myofunctional therapists, the dentists, the lactation, like we were teaching it to everybody. And I wish we could still do that, but
Mhm.
what tends to happen, this is what I keep saying about tongue tie. If what you know about tongue tie is what you know about breastfeeding, you know very little about breastfeeding.
Yeah.
But many people now who understand there's a relationship between tongue tie and breastfeeding, obviously, think that they now understand breastfeeding. And so they go and give exercise they shouldn't be given. Their dentists are telling parents which bottles to use. That is not their wheelhouse. They should not be doing that. So there's a lot of overstepping that's happening now because people perceive this as everything there is about breastfeeding. There is so much science to this profession. There is so much humanity to this profession. Like there are people, humans, mothers, babies, dads, families, partners, grandparents, like everyone's invested in a baby, right?
Yeah.
And so there's so many people who matter in this story. And the idea that, you can just know enough about tongue tie that you can be the person to do all of that, it's very harmful. So I think that, yes, so I do have other courses, but I tend to be very specific about who I'm teaching to for that reason. And there
Right.
are a lot of people who've created other courses. They're very expensive and they market them to everybody and they'll teach everybody. I don't think that's a healthy thing. I don't think that's been a good thing for mothers and babies and families. I really don't. So yeah, that's my opinion. I'm not sure. I know everyone won't agree with that, but that is I've been here long enough to see the outcome of that, and it hasn't been really good for families. And actually, I think that the thing that kind of leads me to talk about is the post-release care, right? Because dentists are the surgeon, or the ENT is the surgeon, or the pediatrician is the surgeon, right? Whoever it is.
Right.
Um, and theoretically, that should be the person who tells the family how to take care of the wound, right? But every single one of them is saying something different.
Mhm.
And what I saw with my families was that some of them were having terrible results because we follow the families forever, right? We're not seeing them only a week follow up or 2 week follow up. And I have a support group for my clients on Friday. So a lot of my families come for years. I have a Facebook group where people have been in it for 10 years. So I see the outcomes for a long period of time. And the dentists aren't going to, which is fine. They shouldn't be following people. They shouldn't have to do that, right? But what I noticed is that certain interventions for post release were very ineffective. And I watched very closely what was effective. And I will tell you, it was listening to a mother that changed everything
Mhm.
for me. A
Mhm.
mother of her fourth child. And she said, because I used to say, do the wound care 6 times a day because I saw that better than the ridiculous 3 times a day. And she said, would it be okay if I did it more often? And I went, wait a minute. With adults, I have them do it much more often because the wounds heal so fast with adults, right?
Right.
So I tell people in the beginning, I'm having them do an elevation and a couple of extra every hour. And I thought, what the heck am I doing? So she did what I said, okay, let's do this. Let's do it before every feeding. Why? Because if the tongue is sitting on the floor of the mouth and you go to nurse the baby's going to engage the part of the tongue they're used to engaging, which is the anterior part of the tongue. But if we do some elevations before an elevation, I'll never do one. If we do an elevation beforehand and we remind the brain that that part of the tongue is engaged and working, now our breastfeeding is like physical therapy. That part of the tongue is engaged, which is the whole purpose of the release in the first place.
Yeah.
Also, can we get a better outcome for our also wounds heal very quickly, right? If we do the wound care before every feeding, we're never tearing it open. We're keeping it open. If
Mhm.
we do it 3 times a day, we're tearing it open every single time. No
Right.
wonder it's painful.
Yeah.
So many years ago, I changed my suggestions. They're not suggestions. This is what I tell people to do. A very simple elevation that takes about 15 seconds. You don't a very simple elevation of the lip, simple sweeps of the buckles, we do exercises too. Please know, exercises and wound care are very
Yeah.
different things. Our exercises are neuromuscular retraining. Those are critical. We do 5 weeks of those. But the wound care, I tell parents, you do this very simple elevation, and I liken it to opening a window. If I open a window, I don't hold it open. I don't count. I don't open it over and over again. I just open it once. Be precise, get it right the first time, and you don't have to do it multiple times. And I just explained to the dentist this weekend because I said, if you give somebody something to do for 30 seconds, their only interest is in getting to 30 seconds.
Right.
They're not paying attention to what they're doing during that 30 seconds. They
Yeah.
just want to get the hell to the end of it.
Mhm.
You ask them to do it precisely and correctly once and it takes 5 seconds, that's a better outcome than just sitting there halfway holding it while your baby's screaming, crying, your eyes wishing that 30 seconds would get over with. So I just think our understanding of families trumps most of what people who are doing the procedures understand. And so I see far better outcomes doing it this way. So that's what I've taught other IBCLCs. That's what I teach families. And then you probably know I introduced serapeptase
Mhm. Yes.
about 8 years ago. Thank you to Dr. Kendall and Dr. Myers. Dr. Myers was injecting into keloids and in Florida, and I talked with, and that's just not sustainable. We can't do that to babies, right?
Right.
And so Dr. Kandel said to me, "You can figure this out." He's like, "There has to be an enzyme you can use. Just go figure it out," because that's Lenny. So I was like, "All right, accepted." And my mother-in-law had had a condition where she made too many platelets, and 30 years ago, I figured out using proteolytic enzymes for her. And so I had her on proteolytic enzymes 30 years ago to keep her platelets from causing a stroke. And so I was like, wait a minute, I know this stuff, right? So I went and did a ton of research and we started using serapeptase. I started with adults and then babies who had keloids or who had a lot of scar tissue. And then I was like, what the heck? We're doing this with every baby. And so we do it with every baby and it makes the wound care so much easier. So many parents will tell you it's a game changer. And so we just need that's the kind of that's what I mean about having conversations and asking questions and talking with each other and, solving problems to make things they give a better outcome and make things easier on families, right?
Yeah.
So we need to keep doing those things in my opinion, right? How do we make things easier?
And you're constantly um, foraging, looking, like constantly. I can see you as somebody who never rests on the information of yesterday and what worked then because of that. You live with families in the day to day when you're caring for them, meaning like when you journey with people, you're in dealing with this epigenetic swirl of the world. Like we're always going to need to keep looking for what helps. So, um,
Also, we are really struggling to get ahead of
yeah, yeah,
the reality of what's happening in our environment, right? I tell parents now that we used to be able to solve something and kind of go on our way. Today, it is a daily practice. It is a daily practice to think about wellness. We don't have the wiggle room we used to have. It really matters what we do every single day. And
yeah,
as I remember his name, Tony Robbins said, when you want a better question, and when you want a better answer, you ask a better question, right? So when you get to that point where we hit a wall, well, then what's happening? Because I think the biggest thing that people fail to do is ask the why. A lot of times when people talk to parents, they'll say, well, your baby doesn't want to, your baby isn't this, that. The language is often adult language imposed on a baby. My argument is, why is the baby unable to do that? Right? And mothers are amazing. Mothers read their babies and they compensate for their babies with utter brilliance. And so you have to be able to recognize that that is happening in order to move out of compensation into competency, right? And so the mother who has to like lean far to the side to get the baby to latch on the left side or has to switch to the football on the left side, that's a compensation. That's a brilliant mother, but it's a compensation that should not be happening, right? And so we have to be able to say, why is that all the baby can do? Why is that what the mother has to do? Why is that what the parent has to do for the baby to be able to sleep or to quiet or to calm or to whatever? And then we can get to the answer because we're asking the right questions, right? We can't ask from a place of presuming that dysfunction is normal or that a baby doesn't want to do something, right? Because that's so harmful to the parents to believe that, right? So I just think it's how we ask the questions and that we keep asking questions, right? That's how we I just had a family this past summer where I saw something I'd never seen before with a tongue tie. And I told the mother that. I said, "I don't know the answer. I have not seen this before." It was an Eiffel Tower. Eiffel Towers need to be released in 2 locations, one at the alveolar ridge and one above the salivary ducts. Dr. Kandel is beautiful at that. He does it so well. But the way the baby was healing was just something I hadn't seen before. And there was something about the tension in the way that baby was responding to healing. And we actually had to do a second little release right above the salivary ducts because the floor of the mouth was tenting up.
mhm,
That second little release, but Dr. Kandel was willing to listen. He was willing to do, right? And we did it during my course in the summer. So everybody kind of got to see the floor of the mouth just sit down. It was like the tent went away.
wow,
Right? But it was the mom who said, "I know this isn't right." Right? And we're like, and we could have just said, "Oh, it'll take time," because that's what people tell mothers. That's how they dismiss them, right? It'll take time. She was right. Something
mhm,
wasn't right there. And we had to go back in and feel it. We had to listen and we had to watch and we had to pay attention. We had to ask a better question. Why is this happening? Right? So I just think that should be the mantra, if you want, of all of us, is this: we need to ask better questions because the challenges keep changing. They keep emerging, actually, right? So, yeah.
Yeah, well, that's powerful. Okay, we're so many potent lessons in, and I know you just kind of we distilled and crystallized so much into a short period of time, relatively speaking. But before we finish, I want to ask you. I want to bring up the fact that you told me, I love this, that you've given. Speaking of story, speaking of purpose, speaking of why, you've given each of your kids, the three of them, The Alchemist, the book. And I love that. That's kind of part of the reason I named my podcast Compromise to Alchemize.
Mhm.
And so there's that phrase near the beginning where Melchizedek, the old king, says to Santiago, the protagonist of this book, he says, the universe conspires in your favor when you are in pursuit of your personal legend. So if you
Exactly.
wouldn't mind sharing your personal legend, and as the legend is a figure on a map that shows you where you're at on the map, how do you know you're staying in line and in tune with that legend?
I think that there are some things we talked about that really, reflect that universe conspiring, like that baby, that was the article about homeopathy arrived in the mail, by the way, that day that I
Wow.
that I came home from the hospital. So that's an incredible example of the universe conspiring, right? Um, I I think that my many years ago there was this thing online where you were supposed to come up with the 6 words that define you.
Mhm.
My 6 words were, "What can I do for you?"
Mm,
And there's a double-edged sword to that, trust me. And so I've pondered that over the years and thought about how that has carried itself in my life over the years. And I recently was talking with my son, my youngest son, and I said, I used to feel more aligned when I was more energetically focused, as opposed to, I feel like I've fallen too much towards I don't want to say clinical, because clinical work should be energetically focused, but I feel like I've fallen too much into that space, and I need to bring that energetic back into my own life. And so when I did that, and I consciously did that, what I realized is that my legend, my gift, however you want to word it, is I know what people need, and I know who they need to see, and it isn't always me at all.
mhm,
It could be a book they need to read, and one of my friends said this to me recently. She said, and I've known her, we had our first babies like 6 weeks apart, right? So we're talking 38 years. She said, "You have always known what people need.
mm,
You've always connected people with who they need." And I feel like I've always known when a new book shows up, a new person shows up, I'm like, "Someone I know is gonna need that." I know it. It will happen. And you could say, well, that's just my brain making that happen, right? You could say that because it's the most recent thing I've come across. But I don't think so. I think that connections are the thing that I am good at. And I think it's why I do the work that I do and why I've been able to see the things I've been able to see. Edith Kernerman, who's amazing, IBCLC in Toronto, said you can see white dots in snow. I think I can. And I think remember I said to you, I think it's just being human
mhm,
and just applying the part of us that is very deeply intuitive. Laura Day has said this. She wrote the Practical Intuition, which I read when I was pregnant with Leo, and she wrote The Circle. I did a 5-day course with her on The Circle. And Laura's argument is intuition belongs to all humans. We
mhm.
just suppress it, right?
Yeah.
We just suppress it. And so I think that that is when I am aligned, it is just recognizing, what does someone need? Where how do I think about it like I say this often, bumpers in the bowling alley. We just make sure people don't go in the gutter. We're just kind of bumping them. Okay, you need a little bump in this direction. Here's something that you might not have thought about. Here's a book you might not have read. Here's a person you might not have thought to see. And often that's what it is. And that is an incredible connection through the whole world in that way. Do you know what I mean?
Mhm.
I don't know if that answers your question, but that's how it feels to me.
Yeah. Oh, so well. Um, in that, you just can see the way that you have poured yourself into what you do because you don't separate those two things. You
Right.
are you spilling into your work with the people that you see, and I love that. So, yeah, that is really powerful, and I think you answered it really summarily, meaning your legend is kind of that as well, is I mean, your how do you know you're on that path? And it's like, well, you live and you're aligned. And so maybe to ask a little further onto that, are there current practices that keep you really aligned? Is it kind of on autopilot at this point, or
It's
how do you stay tuned in?
it's not. So for me, because I have a history of a lot of like, I wasn't breastfed. I wasn't attachment parented. I wasn't responsibly parented. So I came into being an adult person with a lot of those challenges,
Yeah,
right? And so the things that make a big difference to me are being physically connected in the world. Like that's hard for me. So I have to be intentional with that, right? So like I don't ever wear shoes if I don't have to, as an example of being just in physical touch with. I
yeah,
always get the morning sun or the morning light in my eyes. Absolutely without fail, have to do that, right? When I do those things, I feel more connected, right? Um, I have a sauna. I do sauna. My diet is really important to me. So in terms of, nourishing my body, it's really important to me. I don't really compromise on that. Um, activity is really important. I practiced wushu Chinese martial arts for 10 years. I have had some serious injuries this year. I dislocated my shoulder and my elbow and broke my wrist. Not in the same injury. The wrist came just as my shoulder was healing. So it's been really challenging for me to do some of the things that I'm used to doing, and I feel like movement is critical. When I started to feel that I really needed, that my body wasn't healing well. But before this, I remember saying to my homeopath who retired, and I now see Grant Bentley in Australia. Um, but I said, I feel like a forest that has, what is it called when something turns into amber? A petrified forest. Our
mhm,
bodies are meant to move. Movement is critical to life. Movement is life. Without movement, so for me, when you say, "How do you know you're there?" It's when I feel the fluidity.
mhm,
That's when I know. So
mhm,
if I start to feel like things are more crackly, crunchy, not fluid, I know I'm not there. Whether it's physical or
mhm,
because they're the same story. It's the same story. You're not there emotionally, you're not there intellectually, you're not there physically. It's all the same story. So when I start to feel that, I know I'm not there. So I have to step back and say, okay, what do I need to do to feel that? Do you see what I mean? That's like my sense of true north, if you will.
yeah, love it. Wow. Yeah, well, wow. I am so thankful that you shared all this wisdom. I feel like it was also with my theme, the lead into gold, gold, so much gold, so much to chew on, pardon the pun, so much to consider. So there's so much more, but I think this is a good place for us to say
Yep.
how can people, that don't know where to find you, they're gonna click, but people that just listening, watching, where do they find you? How do they kind of seek out more of what you're doing and what you're sharing?
So, yeah, if they're a professional, then the ibclcmasterclass.com website is where they can. I actually don't have a website for my practice. I consistently it's a really tough thing for me because as an artist, I can't just have someone make a website, but yeah, I haven't had time to do it myself. Um, and so what I have is you people can email me at holisticibclc.com. um, I mean, that's kind of where, yeah, right now. Once I get the parenting course up, I will have to have that again. But
Yeah.
at the moment, I haven't needed it from a business perspective. I do have a Instagram, which is holistic IBCLC, but I'm just not that active because I don't have the time.
Hmm.
Um, yeah, unfortunately, I could do better. You do better than I do with those things. I could do better there, but it's Also, I don't wanna be competing, like, I'm not trying to be an influencer, right? That idea really kind of doesn't work for me, so I'm not trying to do that.
Yeah,
So,
no, it's good. Thank you so much. Thanks to Alyssa, my podcast person, and Kat on my team. They're the only reason all my things go anywhere or do anything. So, thanks to them, but thanks to you for sharing so graciously. And I am going to be so excited to share this, but also get more people that want that wisdom to, whether they're parents or not, practitioners, to come seek out your information. So thank you, Jennifer, for sharing. Any last words of wisdom? Any thoughts to share before we finish up?
I guess the only thing I would say as it kind of is the theme of what you and I talked about, right? If you're a practitioner, listen to the parents.
Hmm.
If you're a parent, trust yourself.
Hmm. Yeah, yeah, yeah. Beautiful. That's great. Those are powerful, potent. Yeah, those words. Well, thank you, Jennifer.
Thank you.
And I really enjoyed our time together. And I'm so looking forward to just seeing more people. Well, hopefully collaborating more, but more than that, just listening to people in a deeper way. I'm inspired to do that even more after our talk, so I know others will too.
Thank you so much. It's been fun talking with you.
Yeah. Okay. Well, um, y'all know where to find Jennifer. Tune in. I'd love for anybody to comment and just reach out with any questions you have, and I'd be happy to answer them. And when I don't know the answer, I will ask Jennifer. Thank you for listening to the Compromised to Alchemized podcast. Really excited to thank Jessica from Lunalux for the music. This track called Major. I want to thank Toshi, who originally did the design work for my cover art. And then I also want to thank Alyssa, my team, for podcast publishing, my whole team, including Kat, for heading up my world. And then also definitely want you all to follow me on YouTube, follow the podcast on Spotify or Apple or wherever you get your podcast. Comment, give us a rating, and also follow me on Instagram at Dr. Neil Bulchandani so you can stay tuned to my latest. Thanks so much, and you have an amazing day.
This is major.